Welcome everyone to the ATC webinar on the CalFresh application experience. I'm Jennifer Tracy, consultant with the Alliance to Transform CalFresh, and I'll be hosting this webinar this morning along with Sarah Palmer-DeFrank from the California Association of Food Banks. This is a continuation of our webinar series in identifying barriers and solutions to improving access to CalFresh. And we have about 66 people signed up for our webinar today, so thank you all for joining us. And you're all representing counties from throughout the state of California. So I'm going to briefly introduce the Alliance, and then we'll introduce our webinar and our webinar leaders. Next slide. Before we move into the San Francisco Marin's presentation, I'll give a little background on the Alliance to Transform CalFresh. We were founded in 2011 with 7 members, and our overall vision is to become a top 10 state with at least 75% participation in CalFresh. Our approach has focused on being data-driven and using data to inform our understanding of both gaps in services and promising practices. We're focused on customer service and the outcomes of connecting people with CalFresh. To that end, we have identified some key strategies, making sure access to CalFresh is quick by promoting and supporting same-day service options. We want access to be consistent with people being able to maintain their benefits and not having to go through the churning of reapplication. And we want people to be easily and quickly connected by ensuring dual enrollment between Medi-Cal and CalFresh. And our webinar today highlights some aspects of these goals. So for today's webinar, we're going to review the project initiated by the SF Marin Food Bank with an overview of how the project was set up, demographics of the participants that were recruited, and what was learned from the project and some next steps. We'll also be covering how the findings from this project could inspire innovative ways to engage and create improvements in your own counties as well. And of course, we'll have some time for Q&A at the end. So you should have on the sidebar of the webinar a place where you can enter questions throughout the webinar. You can enter those questions, send them over, and we'll be collecting those and going through them at the end of the slides. So really quickly, again, I'm Jennifer with ATC, the Alliance to Transform CalFresh. We also have Becky Gershon, who's the Policy and Advocacy Director for the SF Marin Food Bank, Diana Jensen, who is the Policy and Advocacy Senior Analyst for the SF Marin Food Bank, and we'll also hear from Tiana Wertheim, the Senior Analyst or Senior Administrative Analyst with the San Francisco Human Services. We also wanted to get a sense of who's on the call with us today. So we have a couple of questions. Our first question is, so that we can see who's joined us for the webinar, please tell us if you are a staff member from either a county, a food bank, and by a county we mean a county health and human services agency, a food bank, another community-based organization, or from CDSS. You should be able to take a response. There you go. We'll give you all a minute to vote or put in your feedback. It looks like we have about 75% of you are from a food bank and 25% of you are from another community-based organization. Awesome to have all of you really great advocates with us today. Our other poll, have you ever assisted someone in applying for CalFresh? Yes, if this is your primary role, or if you do it on occasion, or no. And it looks like we have most of the results in. About 75% of you say that this is your primary role. Very awesome. We love our CalFresh outreach workers. 17% of you say I do this on occasion, and about 8% of you said no, that you have not assisted someone applying for CalFresh. Either way, no matter what your role is, I think this will be a really informative webinar for you today. So without further ado, I'm going to hand things off to Becky Gershon.
Hi there. So again, my name is Becky Gershon. I'm the Policy and Advocacy Coordinator at the SF Marin Food Bank. And thank you all for joining us today. So before we go into explaining the design and the outcomes of our project, I just wanted to take a moment to explain how this project came about and sort of how the idea came to be. So we at the Food Bank have a robust CalFresh outreach team in both of our counties, in San Francisco and in Marin. And last year in San Francisco, our outreach team assisted with submitting 1,129 applications, which is a lot. It's astounding. And we like to think of these clients as having gotten the white glove treatment by our CalFresh outreach staff, who help them to overcome challenges in the process of applying and resolve issues as they come up. But to put that into perspective, the county as a whole in San Francisco received almost 24,000 applications last year. So the clients getting the food bank support don't even make up 5% of the people submitting applications. And so when we took the time to really think about that, we realized we wanted to know how the other 22,000 people who aren't getting the assistance from the food bank are doing in the application process. We don't hear from these people because they never contact the food bank, and we wanted to see if there was a way that we could capture their stories and think about some of the challenges and obstacles that they're facing. Serendipitously, we were contacted by a professor in the nursing program from San Francisco State University. This was in the beginning of this year, in around January. And he was trying to see if there was any way that we could work with his students that were studying nursing. So specifically, he was coordinating a course called Community Health and Global Perspectives. And he wanted to find a way to support the food bank while also providing a learning opportunity for his students. So then that led to this idea to do a sort of secret shopper type project where nursing students would follow and record the application experience of clients applying to CalFresh. And so now we'll move on to talking a little bit about the design of the project. So there's kind of four basic components to what we did. First, we wanted one nursing student to recruit one CalFresh applicant. We had nursing students recruit, we called them likely eligible participants for the project. And basically, we just wanted to make sure that the participant wasn't going to be categorically ineligible for CalFresh and that they had a decent shot of getting on the program. So for example, we didn't recruit participants who were receiving SSI at the time. We also had students gather some basic baseline information about their household, their food security status, and their prior experiences with applying for different types of benefits. Second, nursing students gave participants the option of filling in a paper application or doing it online, and they took notes and gathered feedback about the participants' experience submitting it. They asked questions like, did you understand the questions being asked? How long did the whole process take you? And just general feedback on what the experience felt like filling it in. Third,
Becky, I'm sorry to interrupt. Can I interrupt really quickly? I think there's some technical difficulties where we can't see the slides. Can that be addressed really quick before we move on in the presentation?
Absolutely. Sarah's working on it right now.
Oh.
Okay, great. Thanks for your patience, everyone.
What are you able to see right now?
It just has a white screen that says the CalFresh Application Experience Project with your organizer name and the phone number to call in.
Okay.
I guess it got lost when we went to the poll.
Okay. Sorry, everyone. Thanks for your patience. We'll get it back up on track here. We lost the screen. They can only see this. Is our internet up?
while you're working on that, we're going to be having some other webinars coming up in the coming year. We're working on a webinar to go over AB 402 and SB 708 implementation, which is the opportunity for counties to work more closely with their school districts to do more dual enrollment between school meal programs and the CalFresh program. So that will be, I think, at the end of January. So we'll be sending out some more information about that in the coming months. But that's something else you can kind of keep in the back of your mind, that we'll be sharing some best practices and some things to be aware of in your county that will help with that implementation to improve access for kids in particular and families. I'm not sure if we've scheduled any other webinars for the coming year, but if you do have ideas, I think Sarah's been reaching out to many of you through CAP to get some of those ideas. And it looks like we might have our screen back, so it looks like I can see it here.
Right.
Hopefully it's
see the slide that says project design?
Yes. Mm-hmm.
Excellent.
Thanks,
All right,
everyone.
we are back on track.
Thank you, Becky. Go right ahead.
All right, so I talked a little bit about the first step, and then so going on to the second step, the nursing students were giving the participants the option of filling in a paper application or doing it online, like I mentioned, and they gathered feedback about participants' experience submitting it. Third, nursing students did follow up with participants every week, either in person or over the phone, to check in about how the applicant's process was going. So this was to ask, did you have any contact with your county office since the last time we spoke? Have you gotten any letters in the mail? Things like that. And finally, the fourth step, once the participants had gotten a CalFresh determination, the students gathered final feedback and observations from the participant and asked about their food security status again, so that we would be able to compare before and after. Let's see, great. So another thing that I wanted to mention is that we were able to distribute grocery store gift cards to the participants in recognition that this was actually a significant amount of time that participants were committing to in talking to nursing students every week about how their process was going. So we wanted to make sure that we could acknowledge that and thank the participants for taking part. So this slide just talks a little bit about how and where we recruited our participants for the project. As I mentioned, we wanted the nursing students themselves to recruit participants, and we realized that the most practical place to do that would be at food pantry sites, which we, of course, as the food bank, already have relationships with. And so we coordinated with 4 of our sites to do that outreach. You can see here on the map that we had 2 sites in the Tenderloin, 1 in the Bayview, and the other in Viz Valley. And in total, we were able to recruit 15 participants for the project. So 15 nursing students, each following the experience of 1 CalFresh applicant. And I just wanted to share a little bit about who participated in our project and some characteristics. So the majority of our participants were Black or African American, then white, and then Chinese and Latino. The majority of our participants spoke English, but we did have a few Spanish and Chinese speakers as well. And so we were definitely reliant on the nursing students' language abilities here, and we had a few that spoke Spanish and Chinese. So when we were designing the project and developing materials for it, we made sure that we had everything translated into both Spanish and Chinese. For the 1 participant who spoke Russian, and you can see there it shows up as 7%, we actually had another participant in the project who was bilingual in English and Russian, so she was able to help with that client. And in terms of household composition, most participants didn't have children, about 2/3. And finally, the average household size was 2.3. And so before we move on, I just want to reiterate that these statistics about who participated obviously are only about these 15 people who participated, and we're not assuming that this would be the same for the entire population of people who are applying to CalFresh in San Francisco. So it can be a little misleading to see these percentages, I think our instinct is to want to extrapolate that further, but just bear in mind that this is about these 15 specific people. I mentioned earlier that at the beginning of the project, we asked participants about their experience with public benefits in general. And so this slide shows that about half of our participants had prior experience applying to CalFresh. So for most of the people, it wasn't a program that was new or foreign, and in fact, most of them had experience with it before. And 73% of our participants were currently enrolled in Medi-Cal. This is significant because one of the biggest opportunities that we see in order to get the participation rate in CalFresh up is to increase dual enrollment, to make sure that people applying for Medi-Cal are also at the same time applying for CalFresh. And Diana is going to talk a little bit more about this in detail in a little bit. This slide shows the food security status for our participants before and after they were given their CalFresh determination. And we used the USDA Food Security Survey for this. We've broken it down by household composition and gender, but what we really want to highlight here is that 67% of all participants reported low or very low food security at the beginning of the project. And bear in mind that these are participants who are already accessing our weekly food pantry sites, and they're still really struggling to make ends meet when it comes to food. So I think that this highlights the importance of people having access to both food pantries and also CalFresh to meet their food needs. So those were the people who participated in the project, and I've told you a little bit about them. And you might be wondering, well, what happened to their CalFresh applications? Did they actually get CalFresh? So 15 people participated, and 10 actually submitted an application. Diana is going to go into a little bit more detail about this in a few slides, but essentially we had 5 people who signed up to participate in our project that then didn't actually submit a CalFresh application for a variety of reasons. And so of those 10 who did submit an application, 8 people had an interview. And 7 of those people also submitted verification documents, and 6 ended up getting a final determination about whether they were eligible for CalFresh or not. And so finally, of those 6, 5 were approved and ended up getting on CalFresh. So we spent a lot of time thinking about those numbers and what happened at various stages of the process. And what we came up with is this graphic of a funnel, which shows each step of the process and where people fell off. Excuse me. So there's the application stage at the top, and then the interview, then the verification documents, and then finally the determination down at the bottom. And you'll see kind of the icons on the left for each step. So as you see, we start off with 15 people, and then down at the bottom, we see that 5 of them were successful in actually getting CalFresh. I also just want to mention here that of the 10 people that didn't get CalFresh, many of them we actually followed up with them after our project was over to see if we could help them through our outreach staff in actually getting on CalFresh. And so now that I've talked a little bit about the nuts and bolts of the project and about the results, I'm going to hand it over to Diana, who's going to talk about the broader themes of what we learned and how we shaped our recommendations to various agencies about how to improve the application experience.
So before we move from this slide, I just want to point out a couple of other things here. So just so that they don't get lost, but you know, one thing that was unique about this project was that we were following people from the point where they were deciding that they were going to apply, but they hadn't yet applied. So sometimes when you see, I've seen other funnels that show the application process, and they usually actually start with that second phase, the application, where like the group of people that you start with are the people who applied, and what happened to people who applied. And one of the biggest things that we really learned from this project was that, you know, the largest chunk of people actually fell off in the decision to apply in the first place. So the other thing I was going to add is what Becky mentioned, that that we followed up with a number of the people who didn't go all the way through the process, and for a number of those people, they were successful. So I've sometimes heard folks say, oh, well, people pull out of the process along the way. Maybe it's because they kind of know they're not going to be eligible, or they realize that their income is too much, or they really, you know, whatever it is, that they sort of, you know, they may not be at a phase in the application where it's considered a withdrawal, but they're essentially withdrawing. And for a number of the people that we worked with afterward, that wasn't the case. They essentially got sort of held up along the way and just needed, they kind of ended up feeling that they needed that white glove treatment, given the way that that things play out at the moment. So, okay, so moving on. So here we kind of wonder, well, what is the funnel that Becky described, and the sort of additional information from our participant experiences tell us about obstacles in applying for CalFresh. And I want to add here, again, like reiterating these are the experiences of 15 people. So we don't assume that if 1 out of the 15 had a certain problem, that means that 1 out of every 15 people who apply are going to have that problem. But we also at the same time feel that if a person has an experience, that experience is real for that person. So and in some cases, you know, you wouldn't want that to happen, that situation to happen to anyone. So, okay, so moving on, what are the sort of major things that we learned? One was, and this just, you know, this might seem sort of obvious, but finding applicants or people who wanted to participate was not especially difficult. So, you know, you may ask, like, so what, right? And part of that is that, you know, when we look at how, what portion of potentially eligible people in any given county are actually participating in CalFresh, that always sort of starts this conversation about, well, who's not participating and why not, and is it really that there's, you know, is it really that there's a lot of people who aren't really eligible, but they don't get, you know, we don't figure that out based on the population data, or is it that people, you know, they think it's too much of a hassle and they don't want to do it? And we found that with very brief conversations, it was not terribly difficult to get people to participate. So it was not, most people had heard of at least food stamps. They didn't necessarily know we were calling it CalFresh now. And for folks who are not eligible due to, say, SSI, those folks did know that they were not eligible. That was common, that people would say, oh, I can't get that, I'm on SSI. The second major finding was that just that, you know, as our friend at Code for America, Jake Solomon, says, it's like the little things are the big things. So almost every single applicant who participated encountered 1 or more discouraging obstacles along the way. So these are just some examples of the kinds of things that people encountered, and sometimes they were little, but it would have potentially been enough to throw someone off, and sometimes it was, sometimes they were big. So one example is, in San Francisco, there's a primary office where folks typically apply for CalFresh, but there's a secondary office that, you know, if you go to the website, it'll list that secondary office as a place where you can apply for CalFresh. It's not, you know, it's not a, you know, it's not the primary place where people usually apply, but you should be able to apply there. And one woman went to that office, and she took a couple of buses, and she got there, and she said, I'd like to submit my application for CalFresh. It was important to her to do it in person. And they said, well, that staff person who handles CalFresh is on vacation, so you can't, there was no protocol in place to accept the application as sort of as the agency and send that in on her behalf. They did give her an envelope, and she did stick with it and get her application in, but she was very, very discouraged. Another example, and there were many, I can't list them all. The second example was a gentleman who, you know, he didn't, we had done an initial, like, very brief screen, as Becky mentioned, but he wanted to sort of look up more, so he looked up the eligibility information for CalFresh on the state's website and found information about, in this case, it was about assets that it was sort of vague the way it was written, and he interpreted it as, that he would not be eligible. And we had to really talk him back into applying, which he finally did. Oh, sorry, we have I think that will stop now. Okay. We sort of had to talk him back into applying, which he finally did, and he ended up being eligible for almost $200 a month in CalFresh benefits. But I was there for the conversation where we talked him into applying, and he was pretty ready to just abandon it. A third example, an applicant who was granted CalFresh benefits and then told a few days later she was ineligible. And so, that was not a barrier to her finishing her application, but it was discouraging in a way that I could imagine if she told a friend about that, they might say, well, I don't know about this, forget it. There was a lot of feedback about the website as well, folks who did apply online. A few of them found it easy to do, and a number of people just really found it very labyrinthine and confusing. So here's a couple of choice quotes about that. I like the idea that it's like an English garden maze. Okay, next slide. So the third primary observation from this project was that really most participants were already on Medi-Cal. So they, 3/4, 11 out of 15 of the project participants were already receiving Medi-Cal, but were not on CalFresh. And see, in San Francisco's done a really tremendous job of enrolling people in Medi-Cal, especially with the expansion from the Affordable Care Act. So in a way, this is not a surprise that so many people who are low income and struggling to make ends meet have been successfully enrolled in Medi-Cal. But now those folks are, they're in the CalWIN system, and they have not been connected to CalFresh. As an aside, I actually hadn't thought about this until just now, but I don't remember any participant saying, oh yeah, well when, oh, somebody told me that maybe I should apply for CalFresh, or, there really was there was no sense that folks in their enrollment in Medi-Cal had received any communication about how they should do this and that they'd been putting it off. It was just kind of like, it just seemed very unconnected. So when we look at, trying to figure out what to recommend, and it was a bit of a challenge because there were all of these different types of experiences that people encountered that were, especially all these little barriers. One that wasn't mentioned there, and I know Tiana's going to talk about this one a little bit in a few minutes. Like for example, the state paper application is a state form, and so we discovered very quickly that the state form doesn't have anywhere on it for counties to indicate where to turn it in. And so, that's one example of like, how do you make sure people actually have the information they need to apply? Or sometimes there's a lot of phone tag. There's all these sort of different little obstacles. And so we're trying to think about how do we recommend specific concrete fixes to problems that we encountered, but also how do we make some recommendations that are kind of bigger picture. So the first big one, as I mentioned, is connecting CalFresh to Medi-Cal at every turn. It's just this huge opportunity. Unfortunately, as things stand right now, it's not possible to just sort of automatically enroll people from Medi-Cal into CalFresh. But what are the steps that we can make to make that as easy as possible and seamless as possible? So first, locally, we're advocating to have sort of a plan for improving and tracking dual enrollment. So part of it is just knowing, I know Tiana's been working dutifully on this, and I'm sure she'll talk about it more, but sort of even just understanding like how many of the new applicants on CalFresh and on Medi-Cal are applying for a single program versus a dual program, or how many people who are on Medi-Cal are with certain aid codes are actually on CalFresh, and how to, what should be our goals in those regards. So locally thinking about that stuff and certainly tracking what's happening. At the state, there's, developing any guidance on allowable dual enrollment mechanisms. So if there's clever things that different counties are doing that's helping to move things along that are really allowable by state and federal law, the state should be doing everything it can to promote those practices and say, this, you can do this. This works. Streamlining technology for online dual applications, that's really probably a consortia recommendation, like a state level recommendation for the consortia. We do see when we look at the data that the C4 consortia seems to have better dual enrollment rates than CalWin, and so trying to understand better at the state level, why is that? You know, what is it about the technology that maybe encourages things in a better way in one place than another? And finally, at the USDA, guiding the state on thinking about possibilities for dual enrollment, and it's not listed here, but sort of being open to the idea of reverse express lane opportunities. So our second recommendation is really about figuring out better ways to gather this information about the challenges of applying and staying on CalFresh, and how do we have a feedback loop for this stuff? So we're calling this Ask, Improve, Repeat. Create a system. This is at local level, at the state level, at the USDA, for making improvements by soliciting, reviewing, and analyzing feedback on the enrollment experience. So locally and at the state, developing and implementing a transparent local and state system for doing this. You know, one thing we realize is that, and I'm sure given how many CalFresh outreach folks are on the call, you know, it's not uncommon to you encounter some barrier, right? And currently a lot of times the mechanism for reviewing and analyzing that feedback is to essentially say to your neighbor, "Can you believe this happened?" And they say, "No, that's terrible." And then you kind of goes on from there, right? There's not really necessarily a system for sharing that with the folks who can make a change, for asking what's possible, for finding out what they do in other places. So we're trying to investigate how to do that best. And then the USDA does have some formal roles in monitoring the state and counties in terms of addressing issues. But a lot of the monitoring by the state and by USDA is really on a case-by-case basis. So perhaps there's a concern raised about a particular case, something didn't go as it was supposed to. You know, the real question that's being asked is, did you solve that problem for that case, as opposed to saying, you know, is that a problem that's coming up regularly, and how can we make sure that's not something that's happening again? So those are our major findings. You know, now what? What do you do now? So the first step was we've finished writing our report, and you can see that's what it looks like. There's a link at the bottom where you can find it. You can see a lot more detail about the kinds of things that we found. And now we're sharing it at all levels. So that means you guys, we certainly shared it a while ago with our local partners. I'll be sharing it in a more formal presentation on Thursday at CDSS, and incorporating recommendations into the advocacy that we do at the food bank and with our partnership with HSA and also at the state level. Encouraging replication. So maybe some of you are in other counties and you're listening to this and you're saying, gee, maybe it'd be worthwhile for us to do that here. So we are open to having conversations with folks who are interested in pursuing a similar project, or maybe it's a slightly different project but with a similar end. So please, our contact information will be at the end of this. And then developing ongoing mechanisms for collecting data and creating accountability. So I think I'm passing this on to Tiana here. Let's see. Yes. Okay. So as far as creating mechanisms, Tiana Wertheim is our beloved partner at HSA and has been really helping us figure out where to go from here. So I'm going to pass it on to her, and Tiana, maybe you can share what's next.
Yeah, hi everybody. This is Tiana Wertheim. I'm with the San Francisco Human Services Agency within the CalFresh and Medi-Cal programs, but keeping in mind that it's only recent that in San Francisco we have in any way integrated our CalFresh and Medi-Cal programs. So my background is really CalFresh. I just want to step back and say a few things. One is we as a county, and I can imagine the feeling is held among many counties, we want to know how we're doing. We want to know what the client experience is, and it's very hard for us to gather that information. So it was years ago when I was talking to our director here, couldn't we do some secret shopper? What would it take? Who would we have do the secret shopper? Could we get interns? Should we do it ourselves? So I, for example, went to a building where I wasn't known and I applied for benefits there. Our previous deputy director has also done that. But we found what the food bank offered to do and now has done kind of an incredible resource that kind of incredible information that was very difficult for us to capture on our own, which is how do you get feedback? How do you see things from the client perspective? Because it's as if we're getting dressed in the morning, but we have no mirror to look in. And as an agency, just somewhat overwhelmed with ACA and the integration of our two benefits and just kind of everything that goes with doing this work, even pre-ACA, I think it's easy to get caught up in all the business process and all that's involved in staffing our staff and adhering to the kind of ongoing, relentless, narrow rules and regulations that govern a lot of what we do. And it is hard in some cases to give ourselves the breathing room to step back and think about, from a client perspective, what these services feel like that we're creating and maintaining, and really to kind of bear witness to what's working or not working. So in my perspective, the food bank kind of gave us a great gift in taking on this project and working with a local college and making this all come to pass. And I think part of the way that they've been able to do it was not as an aggressive, critical advocate, not as someone who is trying to bark at us and criticize us for all that we're doing insufficiently, but more, and this is a way I think the food bank here in the Bay Area has been very active in collaborating with our agency and presenting it as a partnership, and we want to help you do the best you can for your clients and our shared clients. And I think kind of the framing that way in some ways is the only way that a project like this stands the best chance of being useful. If this was being done by more aggressive advocates that liked confrontational tactics, I don't think we would have absorbed the information in as useful and relevant of a way. So I just want to say, if you're a nonprofit out there, an advocacy organization on the phone that's excited to potentially do an initiative like this, I would really encourage you to talk with the food bank about kind of how they establish the relationship with the agency. I mean, you guys came and talked to us before you really did much of the initiative. Then when you had a draft report, you shared the draft report for us and got feedback to make sure we understood what you were saying and that it rang true to us and so forth. So this wasn't really a slap in the face. It was more trying to have a kind of organized way to give us information that at least many of us here were really happy that you were providing. So, and also when I referenced, I've gone and applied for benefits and other staff here are too, I think it is important that you guys were, as a community-based organization, and also with, I think you said SF State, or I think it was SF State, not City College, but whichever one it was, you were able to get direct feedback from clients without having kind of a government person listening to the conversation. So you got information a lot more effectively than I would have if I had gone and talked to these same clients in terms of a basis of trust and a no real reason for them to feel like they were threatening their, whether it's citizenship opportunities or whatever it is, when they often get anxious talking to government representatives. And then a lot of the ideas that were generated confirmed suspicions that we already had or reminded us, oh my God, we really do have to prioritize that. So for example, Diana referenced one of our buildings. There's sort of one big hub in San Francisco that is the office where you apply for food stamps, and there's another office that doesn't do much of any public benefits, although we have one staff person there who, when he's there, has been accepting CalFresh applications. And it's been on our to-do list for a really long time to reconsider the work activities at that building, and should we staff it differently, and should we really take more CalFresh and Medi-Cal applications there. We could have taken the feedback from the food bank to be like, oops, we shouldn't have let the website include 3120. That was our bad, because what the food bank is saying is you posted it as people can apply at 3120, yet when our client went, they were turned away or not able to drop off the document. But instead of, running to take it off the website, which probably we should do until we get things cleaned up, it was just a reminder to us, God, that is really important. Let's carve away the staff time to figure out how to make a workable outreach station in that building. Some of the information that these guys shared back, in no way had bubbled up, wasn't really on our radar screen yet, and so it was good to kind of realize for the first time. So for example, one thing that the applicants found, I think some of them picked up paper applications in our lobby and then maybe took them home with them and filled them out and didn't know how now to submit them, where to mail them, where to drop them off. And we just hadn't really considered that yet. So it was brought to our attention, and then holy crap, we're not in control of this form. It's a statewide or even federal form. We can't control it, but with the help of the food bank, we started thinking about, well, how about a cover sheet that we could include on that? So I think the feedback both confirmed what we many feelings we already had about things that we wanted to put higher on our to-do list, and then also some thoughts that hadn't come to mind yet. So what we have done so far is, with the nudging of the food bank, established a feedback loop meeting, which we've had the official meeting one time now. And the idea there is that we have our senior managers from both CalFresh and Medi-Cal and our staff that do reception in our buildings, our eligibility workers that do face-to-face work with clients or even on the phone, and then staff from the food bank to kind of percolate the findings that the food bank has shared with us and think about what to do about it. It's hard because the to-do list is very, very long. So I think if you go to the next page, next slide here, I'm on the design cover sheet for applications. I can't see what you guys are doing, so you could already be on that slide for all I know. But anyway, what the food bank did in that first meeting that you can't really see here on the slide is Diana came and she sort of brought 4 topics to this feedback loop meeting and said, let me bring to your attention, 4 things. One is some clients aren't clear how and where to return the application or where to ask for help. That was number 1 of the 4 options. Another one was this business about 3120, that building, 3120 Mission, kind of not really being a workable business process to support CalFresh applications. Then another one was the scheduling of phone interviews, and that some clients were kind of getting called when they couldn't answer the phone and having a big cat and mouse game that was kind of inefficient in getting the phone interview handled. And so what Diana did is said, okay, here are 3 of many ideas or many concerns. Which of these 3 does this group here want to first tackle, and how do you want to tackle it? And we chose to go with creating a cover sheet for applications. And we primarily chose that because I think it was the most straightforward, simple solution that we could focus on for our first meeting or 2. And the food bank generously offered to go and then draft what will become this cover sheet. Probably what will happen is they'll bring us a draft, and the group will look at it, and we'll probably pilot it, at least do some focus groups with clients in the lobby to make sure it makes sense to them, and then launch it in some capacity. So this is just the first step in that feedback loop meeting, and I think kind of in some ways the greatest victory so far has been to establish a dynamic in which the agency is game to listen to the concerns and to start brainstorming potential solutions or steps that we could take. And it's a very mixed group from many levels of staff, and I think as usual there's some people within an agency that are kind of more open to making change than others. So it was sort of a big hurdle just to get this far, and I'm optimistic that we will continue to go forward and make improvements. So on the next slide, on the dual enrollment work group, so the reason that we mention this here is that one thing that the food bank has been advocating for a long time now, and so has the Alliance to Transform CalFresh, is take advantage of the clients you already have receiving one benefit and help them get any other benefit they might be eligible for. And as Diana mentioned, a large portion of our Medi-Cal population are not receiving CalFresh but likely eligible for it. So it's only about 18% of the people on Medi-Cal are on CalFresh versus about 74% of the people on CalFresh are getting Medi-Cal. So we have a great opportunity to do more outreach within Medi-Cal. And this is something that we've known, but I think, again, with the nudging of the food bank and the very polite, gracious reminders, it's encouraged us to more focus on it more closely. And so with that positive pressure, our deputy director has directed the creation of this dual enrollment work group, and the task of the group is to make recommendations to our executive leadership about how to restructure our business processes to promote and simplify dual or triple enrollment with CalFresh, Medi-Cal, and CAP. And CAP is our local GA program. Most of the emphasis is on CalFresh and Medi-Cal, but we also are trying to identify any low-hanging fruit with CAP applicants and recipients to get them on their 2 other benefits. The participants are, as in the feedback loop meeting, it's a similar group but bigger of program managers from those 3 programs, supervisors, eligibility workers, lobby reception staff, our records management staff, our ADA service manager, planners, and our HSA Department of Office Innovation. So it's a big effort. We've only met twice so far, and a lot of the work is going to be everything from defining what our, objective and targets are, what percentage of people who are on Medi-Cal are we striving to get on CalFresh, how do we measure that, and then a lot of the focus will be on business process. What are the steps to intervene? Are some kind of in terms of technology, any changes we have to make within our CalWIN system to allow staff who are interviewing a client, let's say they've interviewed a client and initially they've said, what are you here to apply for, CalFresh, Medi-Cal, or CAP, and they've said CalFresh, and they go through the CalFresh application, and then 3/4 of the way through it, they say, it really looks like you're eligible for Medi-Cal. I'd only have to ask you 3 extra questions. Are you game? Right now, there's not an easy way for the worker to add that program. They have to get up, they have to go talk to our reception staff who have the skills and know how to add a program, and so it's sort of clunky. So business process-wise, how could we improve it? In terms of scripts and what we even say to clients who come in, there's some reception staff that probably just say, what are you here to apply for? And, the person says food stamps, and that's it. That gives them whatever they need to do. And the thing that we're thinking about right now is how to take advantage of behavioral economics to phrase the question differently. For sure, to start with, assuming the default is that the client is here to apply for all benefits they're eligible for, but other ways to refine the script that might, continue to promote it. So there's lots of work the group is going to do. We're going to keep meeting every 2 weeks. At the bottom, I say we're seeking professional expertise to help us to figure out how to employ these strategies of behavioral economics to promote cross-enrollment. I just threw that in there in case if you or someone you know is an expert that can help us think through those behavioral economic strategies, we'd be really happy to hear from you. Okay, and I'm passing it to Diana to talk about lessons learned.
Okay, thank you, Tiana. So lessons learned about this project is, as Tiana mentioned, make it a collaborative project with your county's CalFresh team. So that can look a few different ways, probably depending on what kind of relationship you already have with your county. I think one thing I would add to that is that it is really important, I think, to have your county counterparts feel in the loop and understand what's happening. And at the same time, there's no. It's not like I think it's fair to say that we didn't go to the county and ask permission to do this. We said, we have this opportunity and we think it's important and we're going to pursue this, and here's what's happening. The clients who are applying are our clients too, and so I think to the degree that you can make it collaborative and make sure that everyone is in the know and that it's respectful and has the right tone, that's super important in terms of being able to get things done along the way and have it work well. But also being respectful that the community of applicants and the folks who are applying are, you know, they don't belong to anyone. They're their own people who are having their own experiences. So working with students is a good idea if the goal of your project is to have folks who actually are not experts in CalFresh. You know, we realized we really could not do this project ourselves. Like, we could not have our CalFresh outreach people try to figure out what it felt like to apply without help, because they're really so great at helping that they're incapable of not helping. It's like really painful for them to try to not help. So the students were great because they were, you know, it was a project they felt they were assigned to, and they, you know, they didn't come to the table, most of them, knowing all that much about the program. So that was a great opportunity. We said here, pare down the survey questions and keep observations and commentary qualitative and open. This is really a lesson that we learned by, you know, we had all these really detailed questions that the students were asking those clients at each week, and it got to be a little bit much, I think, for the participants. I think we would have gotten just as much useful information by having a few pointed, you know, fairly open-ended questions and a bit more discussion with the students at the front end about what kinds of answers they might get, so that they could probe if necessary. So recruit participants for places where it will be easy to connect with them every week. So really, you know, the application process and the decision to apply in the first place can take a while. So you really do want to find, we had a lot of success. Some of the, you know, we really did recruit at food pantries, and in some cases those food pantries were in places where people lived. So it was easy to to connect with folks again. And then the last one we did this just a little bit, but not as much as we could have, is encourage the students to apply themselves. So we did have one student who she was not following an applicant, but as she kept trying to recruit somebody to be a participant, she realized that her family was likely to be eligible for CalFresh, and so she had her husband had just lost his job recently, and they had a small child, and so she actually applied herself, and with some encouragement to really track her experience, she you know, she really got kind of into it, and she applied online, and she had some sort of screenshots of things that were confusing to her on the application. She had a few challenges with phone tag. I mean, it really was it was an interesting application experience. So figuring out how to encourage students to actually sort of be the secret shopper themselves. It may be that if you work with a county, you know, depending on how big a group of students, we didn't have all the students apply because we didn't want to be flooding HSA with applications that weren't likely, you know, weren't real, kind of. I mean, of course, anybody can apply for CalFresh, and you'd just be denied if you're not really eligible. But we didn't want to artificially create extra applications. But perhaps if you had a smaller group of students, then you could, you know, that wouldn't be as much of a concern. So those are sort of our lessons learned. We're excited to sort of see where this goes next. At the end here, we have all of our contact information. Becky and I sort of developed and pulled together all the materials for the project. You're welcome to contact either of us with more questions. We're going to be emailing the final report and these, I assume, and the webinar is being recorded, so it'll be available online. Tiana's wonderful, so contact her with anything. And I think that's it. We're going to ask if there are any questions. You can, how do you enter your questions? Oh, are there questions?
You can enter them on the sidebar. They open their sidebar. There's a spot where they can enter questions. Okay. And we can share them. While we're waiting for questions, I was curious about, you mentioned that people were overwhelmed by the application. Did it make a difference if it was a paper application or if it was online, or was it either way it was an overwhelming kind of process?
I would say that I would say that it was different depending on if it was the paper or online. I think the online My Benefits CalWin application is many applicants found it to be there's just a lot of screens you have to click through. We had one applicant who was very diligent about reading all of the fine print, and so she would often be timed out. So that was those kinds of things on the online application. We actually had a number of online applicants who had problems with being timed out. Whereas the paper application, it's just very jargony, I think. Like the questions are very, like even just, for example, at the beginning it asks you if you're applying for, you know, I forget what it says, food, medical, or cash aid. And people, people are like, oh, cash aid, that sounds good, but it doesn't really say anywhere what that is. People were just sort of confused. Or, for example, the first page of the application has information that sort of screens for expedited services. But some people, they were concerned that if they were answering no to a bunch of those questions, that might mean that they weren't eligible for CalFresh at all, when in fact it means that you're not eligible for expedited services.
Okay, so keep your questions coming in. We have one question right now. How long did the whole study take, start to final report publication?
So I think we started having the conversation about the project in January, I think, and then we finished writing the report and put it on our website, completely done, about a month ago. But the process with the project, with nursing students actually following the application process from start to finish, that probably took about a month and a half to 2 months.
Yeah, well, especially because I mean it fit well within the semester for them. Are there other questions?
Yeah, please submit your questions if you have any.
I'll just ask another question. Did you guys get a special funding for the gift cards for participants, or did you just use some of the funds that you had? Because I know I don't think we can use our CalFresh outreach dollars for the gift cards, for example. So did you guys have another source that you used for those?
That's a good question. I think we used our own policy and advocacy, some money in our own budget for that. Although I would say we ended up with, in terms of how to budget for that, if anyone's pursuing this, should probably be in touch with us, because we ended up with a bunch of extra gift cards, basically, because it turned out that the way we structured the incentives were that you got a gift card after you did the initial questions, but then you would get a second gift card after you actually applied, and then more after you completed the application process and were determined. But since so many people didn't complete many of those steps, we didn't need all of the gift cards for a lot of folks.
That's really helpful. Helpful insight about that. I don't see any more questions coming in, so and we're about out of our time. Any other last comments? I think you guys covered things really well, and your contact information is available. So thank you to Tiana from the San Francisco Human Services Agency, and Diana and Becky from San Francisco Marin Food Bank, and your team of nursing students who did such a great job in tracking and following up with people. And thanks for the tech support from Sarah and from Stephanie Michio, who's also been helping out. Any other final comments?
I think that's it.
Okay.